Member for Sanderson.
Madam Speaker, I rise to support the bill. So the Liquor Legislation Further Amendment Bill 2024 amends existing legislation related to alcohol consumption and public order. The primary objective of the bill is to enhance police powers in addressing alcohol-related antisocial behavior. The CLP took to the election a suite of changes it would introduce in the first week of Parliament to reduce crime, and today we address another one of our commitments, to give police powers to fine, charge, and arrest for public drinking in non-exempt areas. Labour irresponsibly unattended to thoroughly addressing alcohol-related harm, as they were obliged to do so by the Commonwealth and, of course, Territorians. Despite having 10 years to prepare for the cessation of the national partnership of the Federal Emergency Response under the Stronger Futures in the Northern Territory Act 2012, that was nationally recognized as an emergency, Territorians have continued to suffer the consequences of alcohol-related harm. As a former registered nurse employed in the CLP's alcohol mandatory treatment program, I saw firsthand Labour's effort in addressing alcohol harm, where they scrapped the alcohol mandatory treatment programs in 2017, despite many positive outcomes that the program delivered. So when I've been checking onto the stats from the government's websites, domestic violence-related assaults in Darwin and Palmerston region increased from 586 in 2016 to 1,277 in 2024. Alcohol-related emergency department presentations in Darwin and Palmerston region increased from 2,313 in 2016 to 4,522 in 2017 and to 5,041 in 2023. And the reason I put like the 2017 data with the alcohol-related ED presentation, that's when the alcohol mandatory treatment was revoked. And there was like almost a double spike in the ED-related presentation from 2,313 to 4,522. And another thing, there were like many members here mentioning about like I think they want to support the hospital system, they want to support the doctors, nurses, but this is what been happened when one program has been revoked, and I think that was impact to the hospital, particularly the Royal Darwin Hospital and also the Palmerston Hospital. In 2017, the Royal Darwin Hospital, then the impact started to come on to the Palmerston Hospital as well. So amendments to this bill addresses the following matters: antisocial behavior associated with public alcohol consumption. The bill creates a new offense that would allow police to better address nuisance behavior in public places where alcohol is consumed. The current lack of clarity surrounding police powers to issue infringement notices in interim alcohol protected areas. So this amendment clarifies that police have the authority to issue infringement notices for certain alcohol-related offenses in these designated areas. The next one is the need for a comprehensive definition of alcohol infringement notice. So the bill broadens the existing definition to include the new offense relating to nuisance behavior and any other provision specified by regulation. This ensures consistency in handling various alcohol-related offenses. The bill ensures appropriate enforcement mechanisms for alcohol-related regulations in interim protected areas. The amendment designates an offense under Section 170B1 of the Liquor Act as an alcohol-related infringement notice, strengthening enforcement efforts. The bill introduces a new offense for consumption of liquor in prohibited public places. A significant change introduced by the bill is the creation of a new offense related to the consumption of liquor in public places. The bill inserts Section 171A into Liquor Act 2019, which makes it an offense for a person to consume alcohol in public place and engage in conduct that causes a nuisance to others. The provision specifies that the offense carries a maximum penalty of 5 penalty units. This new offense is intended to provide police with an additional tool to address disruptive behavior associated with public drinking. This bill provides clarification of infringement notice powers for interim alcohol protected areas. The bill seeks to clarify and strengthen police powers regarding infringement notices in interim alcohol protected areas. Clause 16 of bill inserts Regulation 119 into the Liquor Regulations 2019, explicitly stating that an offense under Section 170B1 of the Liquor Act is an infringement notice offense. This provision carries a prescribed penalty of 2 penalty units. The amendment empowers police officers and inspectors to issue infringement notices to individuals believed to have violated Section 170B1, which relates to alcohol consumption in designated protected areas. Amendment to the definition of alcohol-related infringement notice. Further amendments are proposed to Alcohol Reduction Act 2017 and its associated regulations. Clause 9 of the bill expands the definition of alcohol-related infringement notice in Section 4 of the Alcohol Harm Reduction Act 2017. The amendment includes infringement notices issued for offenses under Section 171A1 of the Liquor Act and any other provision prescribed by regulation. This broader definition ensures that the new offense relating to nuisance behavior in public places is covered under the existing framework for alcohol-related infringements, prescribing offenses as alcohol-related infringement notices. To further support the enforcement of alcohol-related regulations, Clause 11 of the bill inserts Regulation 4 into Alcohol Harm Reduction Regulations 2017. This new regulation designates an offense under Section 170B1 of the Liquor Act as an alcohol-related infringement notice. This ensures consistency in the application of infringement notices across various alcohol-related offenses. In addition to the issues of public nuisance, alcohol consumption places a significant burden on various aspects of society. Alcohol-related harm affects individuals, families, and society. Domestic violence, fetal alcohol syndrome, homelessness, harmful behaviors, crime, car accidents, school attendance for children that live amongst alcohol-related harm and unhealthy levels of consumption can lead to chronic health issues, death, social disharmony, helplessness. For instance, a July 2024 report by the Australian Institute of Health and Welfare revealed that in the quarter ending March 2023, the Northern Territory recorded the highest rate of alcohol-related ambulance attendance among all Australian jurisdictions. Notably, this rate was 5.8 times higher than that of Victoria. The increase in ambulance attendances due to alcohol consumption has a direct impact on hospital presentations. Patients affected by alcohol often exhibit a wide range of cognitive impairments affecting their rational behavior and decision-making capacity. This unpredictability in patient behavior, particularly those displaying symptoms of alcohol intoxication, necessitates additional resources for triage and treatment in emergency departments. Consequently, this diverts valuable healthcare resources away from other potential emergencies and adds to the existing workplace pressures faced by frontline healthcare professionals. The Liquor Legislation Further Amendment Bill 2024 represents a concerted effort by the CLP government to strengthen its legislative framework for addressing alcohol-related antisocial behavior. By creating a new offense, clarifying infringement notice powers, and expanding the scope of alcohol-related infringements, the bill seeks to provide law enforcement agencies with more effective tools to maintain public order. I support this bill. Thank you.